Can you briefly introduce yourself and describe your path to becoming an orthopedic oncologist?
Sure. My name is John Abraham. I am an orthopedic surgeon, and so that is the road to becoming an orthopedic surgeon is starting with college. I majored in biochemistry and molecular biology, which includes all the pre-med classes. Then you go on to medical school. During the course of medical school, you decide what specialty you want to be in. Then you go on to a residency. The residency for orthopedic surgery is 5 years long, like most of the other surgical specialties. And then during that time, you decide if you want to specialize in something within orthopedics. You don't have to, but many people choose to. There are a number of fellowships you can do, which specializes your training. And so I did a fellowship in orthopedic oncology, which, is what kind of gives you that particular specialty.
Okay.
Yeah.
What kind of inspired you to go into this, or what made you want to enter this field?
I wanted to be a surgeon going into medical school. And part of that is because my father's a doctor, and I had some experiences with him, and that's kind of what led me to want to be a surgeon. But then I went through my rotations within medical school, and that's when I decided I wanted to do orthopedic surgery.
Okay.
I was fortunate because I got exposed to orthopedic oncology even as early as medical school. And there aren't a lot of orthopedic oncology centers around the country. But fortunately, I was at one of the places that had one. I was at Yale, and they had an excellent, well-known orthopedic oncologist there. And I did my orthopedic rotations with that particular doctor. His name was Dr. Friedlander. And I really respected him highly, and I thought he was a great surgeon, great doctor, good person. And so, I wanted to be like him, basically. And so that's what led me on that path.
Nice.
Yeah.
What do you commonly deal with now, and what does a typical day look like for you?
So the specialty of orthopedic oncology has a couple of different offshoots. One is the primary thing we deal with is a type of cancer called sarcoma. And sarcoma is cancers that arise in the tissues that make up our arms and legs, basically. So either bone or muscle, nerve, fat, those kind of tissues. When they become cancerous, that's called a sarcoma. That distinguishes it from cancers that arise in your organs, which are called carcinoma. Okay. So things like kidney cancer, breast cancer, colon cancer, all those are carcinomas, and they behave differently than sarcomas do. So the primary work of the orthopedic oncologist is treating sarcoma, and that's often a curative surgery. The goal for those kind of operations is often curative. We're trying to cure that person of cancer. Another division of what we do is managing metastatic disease. So many of the cancers, breast cancer, kidney cancer, colon cancer, they can spread to the bone. And if those cancers spread to the bone, then it can cause the bone to break without any trauma, just sitting there or standing there. And it can be very painful also, even before it breaks. So there's a whole category of patients where we deal with those kind of things, where they have metastatic disease, where the cancer started somewhere else and now it's spread to the bones. Those are not curative operations, but they're very important for pain control, keeping the patient's mobility and things like that. That's another kind of division of what I do. And then many orthopedic oncologists around the country, and myself included, we end up doing some complex joint replacement, not having anything to do with cancer, but just the surgical techniques are more similar to what an orthopedic oncologist does than what a joint replacement surgeon does. So for instance, if somebody's having a third revision of a hip replacement and there's a lot of bone loss there, then that situation surgically may be more similar to an oncology case than a joint replacement case. Okay. And so I'd be the one dealing with it as opposed to the hip surgeon. So that's the other subset of what my practice is. Okay. And then you also said, what was your typical day? It depends on what kind of day it is. If it's an operative day, then we are in the operating room and doing any number of operations. Sometimes it can be an entire day for one operation. Those are often the curative operations. If you have to remove a cancer from somebody's pelvis or something like that, that can be 12 hours long. We may be doing a metastatic disease control operation. That can be a lot shorter, but you may do several of those kind of operations in a day. So those days vary. And then other days are clinic days, which are just like today, where I see patients in the office. Those can be post-op patients that have already had their operation, pre-op patients that are heading towards an operation, or follow-up patients that maybe had their cancer taken out a year ago and now we're following to make sure it's not coming back. Those are the kind of things we would do in a clinic.
Okay. How do you deal with patients that are reluctant to go through certain operations or procedures that are necessary?
Well, I mean, one of the things about oncology is that the operations are not really elective. You know, it's different than joint replacement surgery in the sense that I can say, well, you have hip arthritis and we can do a hip replacement, or you can do this. If you have a cancer in your arm, then there's no or. It's basically, this is what needs to be done.
Okay.
I mean, patients don't always accept that readily because there's often some functional compromise we have to talk about, or it may be a big operation that they have to go to that they're nervous or scared about. But then the issue is dealing with those things, dealing with what they're nervous about, dealing with what they're scared about, dealing with the pain control, dealing with the mobility issues. Once we deal with that, you know, then oftentimes the patients are more accepting of, you know, ultimately what they need. The bottom line is, for a lot of these operations, there's no great non-surgical operation or non-surgical alternative. So, you know, it is what it is. This is the option. I can't force anybody to have surgery, but I can tell them this is what I think is going to make you better.
That makes sense.
Yeah.
Do you also see children?
I do. Being in this particular area, many of the children are seen at CHOP, and there's an excellent orthopedic oncologist team there. So just my practice, just for that reason, I don't get referred a whole lot of children. Sarcoma, there are some subsections of sarcoma that do occur in the adolescent population, so I see more of those kind of patients, and then, you know, then the adult population also.
Do sarcomas have like specific causes, or is it kind of unknown?
So sarcoma is a category, and so there are, you know, we think probably about 100 different subtypes, and then subtypes of the subtypes if you add them all together. Some of those do have some relationship to either chemical exposure or things like that, but the vast majority we really don't know. Radiation is another one that can cause a sarcoma, but you know, out of that list of 100, there's very few that actually have something that we can point to and say, you know, this caused that.
Okay. What are some of the best habits people can do to prevent orthopedic issues and promote bone health?
You're talking about orthopedic issues in general now? Because there's not a whole lot you can do to prevent a sarcoma developing, other than stay away from exposure to PVC or radiation. But general orthopedic health, you know, general orthopedic health goes along with general health overall. So, you know, keeping weight down is important. That's something that really, you know, a lot of people can work on, and it would be important to work on. That it puts a lot of stress. Being overweight puts a lot of stress on your joints. It's more to carry around. It's, you know, it just is increased burden on your body overall. The nutritional intake is very important. What people eat, not only maintaining enough calcium and things that are important for your bone, but also to be just healthier in general in terms of avoiding too much sugar intake and all these. These are all kind of common problems across the country that we have. And, you know, exercise is very important. The bones need stress going through them to build and to grow. And that's called Wolff's Law. It basically means the bone responds to whatever stress you put through it. So if, you know, an example, if you're running all the time, your bones in your leg get stronger because they're impacting the ground. So in the same way, as people get older, it's important to maintain mobility, maintain exercise, even weight, you know, gentle weight training and things like that will help bones get stronger, and that will avoid problems with decreased bone density, fractures, things like that in the future.
Okay. Are cracking and popping noises in your neck and knee areas like just normal, like knuckles cracking, or can they indicate a serious
I mean, there are a lot of different reasons why you can hear noises coming from your bones and joints. Most of them are nothing to worry about. There are some things thought about. There are theories about bubbles forming in the joints which can pop and things like that. There are also different types of noises. Sometimes when two smooth surfaces which normally have cartilage on them, like your kneecap, for instance, when that wears out and the cartilage is gone and then you now have two rough surfaces, you can get a grinding kind of sound, and that's one of the ones we recognize, and that can be a sign that the cartilage is wearing out. In general, sounds like that are not anything worrisome. It's just a sign of something going on.
Okay.
But I would say there's not too much to get alarmed about with sounds.
Throughout your journey to becoming an orthopedic surgeon, what do you think is the most useful skill that you've learned? And what skills do you think are essential for a person interested in orthopedics to develop?
Well, I mean, I'm going to assume you're not talking about like technical skills because those are important. But, I think it's important to learn how to think critically, address a problem critically. I mean, one of the things in my world in particular is that, I see a lot of the things that are not routine. A lesion in the bone is not a routine problem. It's not like everybody's walking around with it, as opposed to something like hip arthritis where, there are differences obviously, but in general, you can make up protocols where you treat everybody that has hip arthritis the same way. You can't do that for bone tumors because a bone tumor can show up in any bone in any part of your body. And even two tumors that look almost identical can behave differently. So then it becomes more important, instead of having a protocol, but to be able to think your way through a problem. And so critical thinking, having an analytical mind, I've learned over the years to think about things in terms of risks and benefits, which is very useful in decision making. Sometimes it can be hard to choose which way a person wants to go. Should I go with surgery or should I go with radiation? Things like that, just as an example. But, learning an analytic process where you can come to a decision based on looking at things in terms of risks and benefits, that's helpful too. So really, I think focusing on logical and critical thinking is one of the key things, that you need to develop in order to get from there to here,
Yeah. What are some subspecialties within orthopedics?
There are a number of subspecialties. There's, hand surgery is one of them. So that's, kind of hand and upper extremity. Shoulder and elbow is its own specialty. Foot and ankle is another specialty. Spine is another specialty. Sports medicine is kind of dealing with ligamentous injuries. Joint replacement, and then oncology. I think that probably covers most of them.
Did you ever consider any of those?
I did consider other specialties. I was interested in spine. I still do some spine surgery in the context of bone cancers. But what drew me to oncology was that it's not anatomy specific, so I didn't have to lock into one joint for the rest of my life. I do operations on people's feet, on their fingers, on their neck, on their rib cage, so that was appealing because it's nice to have that kind of variety. And also I like the patient interaction. You get very close to your patients because obviously, if they're going through a cancer diagnosis, that's a very significant thing. I like the long-term follow-ups because we follow patients for years and years and years, which we don't really do in any other specialty in orthopedics. So this was the right fit for me, but I did consider some of the other ones initially.
Before entering orthopedics, were there any fields that you considered?
There were. I was interested in surgery, so I was looking at other surgical fields. I had done some cancer research in college and medical school, so I was thinking about surgical oncology as a possible field. I was interested in pediatric surgery also, and with a particular interest in pediatric surgical oncology. So I did consider all those things, but there are a lot of factors that go into making the ultimate decision. It's some are factors of the specialty itself, like what do you like to think about, that kind of thing.
Yeah.
Some are technical. What kind of work do you like to do with your hands? Hand surgery is very different from kidney surgery, is very different from spine surgery, just in terms of the technical work that you're doing. So that has to fit also. Then there are other issues like lifestyle issues, things, trauma surgery. That's one specialty I missed when I was listing off the specialties. But at that time, when I was training, trauma surgery was a, nighttime specialty basically. Since that time, a lot of work has come about that has shown that a lot of these operations don't need to be done in the middle of the night, and the patient outcomes are the same or even better if you do them in the morning. So the specialty has changed a little bit, but at that time, if you were making the decision to go into trauma surgery, you were making the decision to have a lot of sleepless nights, So I didn't want to do that, but some people like doing that just because they really like that type of operation. So those are all the factors. There are so many countless factors that you have to consider. One factor for orthopedic oncology is you can only do it in a big city. There's no, there's only 200 orthopedic oncologists in the country, and the big centers that deal with sarcoma are big university centers usually, or nearby to big or academic centers. So in small rural areas, you're never going to find an orthopedic oncologist. So those kind of things also are things to think about when you're choosing specialty.
Do you think it's easy for you to balance work and life now?
I don't think it's easy, and I don't think it's easy in any field of medicine, particularly not surgery, and then particularly not complex surgery. But it's important, and I think it is one thing to consider when you're choosing a specialty, and it requires a focused effort. You really have to make time for the rest of your life, and because you could easily get consumed completely by any surgical field, basically. And having assistants help, having PA, having teams that help, having protocols when you can to help streamline things, all those things. Efficiency, that's a critical thing to learn, is how to get things done quickly so they don't tie up your whole day, so then you have time. And it's important to take time for yourself too, not only just your family, but you need personal time too. So, I think, like I say, it's not easy, but it is achievable.
What's the most challenging part of your job now, and what's the most rewarding part of your job, and something that keeps you motivated?
Well, there's probably, those two things are probably the same thing, which is dealing with the patients. An operation is a technical thing, and any technical thing you can master by doing it enough. You practice something 10,000 times and you're an expert at it or a master of it. Patients are more difficult. It's not a technical thing, it's an emotional thing. It's people have different personalities. There's a lot of, especially in the world of cancer, there's fear, there's anxiety. It changes the way people interact with you, and so that can often be the most difficult thing, is dealing with the patient's personality and their anxiety and their issues and their fear and all those things. But at the same time, it's also the most rewarding thing, because just like you can be a master of doing a technical skill 10,000 times, you also get bored of it. And so, if you were just doing it without the patient interaction, even the most complex operation will get boring. In some of the operations now, I used to think when I started, I don't know, how can anybody be good at this operation? It's so complicated, and it's so difficult, and now those same operations, I don't think that much about anymore, because having done it for 20 years, it gets easier and easier and easier. But at the same time, that having that patient interaction puts that all into context, and that really is the most rewarding part. When you start out, it's very rewarding to do a complex operation and do it successfully and do well, but that kind of fades with getting better at doing anything just by repetition. But the reward of seeing patients do well, curing somebody of cancer, or even just supporting them through their cancer journey by allowing them to walk, even if you don't cure somebody of cancer, just helping them walk, those are some of the most grateful patients we have. And keeping them out of pain is also, a tremendous thing to be able to do for somebody. So, that's really both the most challenging and the most rewarding part of the job.
That's nice. Do you have any advice you want to give to people who may be interested in entering orthopedics?
Well, the first thing entering any specialty is make sure you're doing it for the right reason. So, really think about why you want to do that field, because you're going to be doing it for the rest of your career. It should be something that interests you intellectually. It should be something that interests you from a technical standpoint. You should explore the day-to-day and make sure you're okay with the day-to-day work as in addition to the overall work. A good example is I love some of the medical specialties in my rotations in medical school, and some were very intellectually stimulating, but the day-to-day work of taking care of patients either in the hospital or the clinic without having that operating room facet of the career, it just felt like something was lacking. And so when I got to surgical rotations, that's when I realized, okay, this is what's lacking. I like that, that thrill of going into the operating room, and it's very stimulating. And some may argue, well, that's not as intellectually stimulating because you're kind of trading off some of the intellectual stimulation for technical stimulation, which is fine. I have plenty of intellectual stimulation dealing with complex cancers, doing research on cancer biology and things like that. So, I like taking that time to be in the operating room. If you don't like the sight of blood, you probably shouldn't be a surgeon. Things like that. You have to be honest with yourself. That's probably the most important thing in choosing a specialty.
Okay. Thank you so much for the interview.
No, it's my pleasure.